All right. Greetings, ladies and gentlemen. It is a pleasure to have you here with us today in celebration of World Malaria Day 2021. Thank you for making time to join us. We will get right into the program as we have more people joining us, but it is our honor to have you ensure that you are a part of this session as we begin. I can already see that Miss Joy is online, so I will hand over to her to get into the opening remarks. Welcome, Joy.
Thank you so much for hosting this, and it is an absolute privilege to be able to join you today as we commemorate World Malaria Day 2021. So Your Excellencies, members of the Youth Advisory Council, distinguished guests, ladies and gentlemen, World Malaria Day 2021 is a watershed moment in our fight for malaria in Africa. Progress has stagnated. Even before COVID-19 raged across the continent, it was crucial that Africa address the fact that we're lagging behind. And it is also crucial that we use Africa's most powerful resource, the youth, to engage and drive action and change, effectively harnessing young people's unlimited potential, their innovation and capacities, and leadership to fight and usher in a new normal for the African continent. A development era where increased productivity and reduced poverty without malaria is the normal. The chair of the African Leaders Malaria Alliance, His Excellency President Uhuru Kenyatta, has a vision for an ALMA Youth Army that puts youth at the center of our fight, driving the agenda for increased participation of young people at every level in the fight against malaria and the broader health and development agenda. Launching the ALMA Youth Strategy and Youth Advisory Council in February this year, His Excellency President Kenyatta called for mainstreaming malaria into and through existing youth structures at continental, regional, national, and community levels. Young people determine the development trajectory of Africa, and they will be determining this trajectory for the next 50 years at least. And whether our countries meet the targets for inclusive economic growth and socio-economic and structural transformation will rely on the extent to which this process is led by the youth. At ALMA, we are committed to move this agenda forward by partnering with young people to establish a movement of ALMA youth armies across Africa, generating youth engagement and leadership in malaria elimination and universal health coverage to achieve the bold and ambitious targets set in the catalytic framework to end AIDS and TB and eliminate malaria in Africa by 2030. Whilst minimizing the far-reaching, debilitating social and economic impact of COVID that threatens to derail Africa from its development path, young people and older people alike must lead and must remain resolute in the fight against malaria, building domestic, public, and private sector resource commitments to ensure that a malaria-free Africa becomes a reality. The African Union Constitutive Act, the African Charter, Youth Charter, and the African Union Roadmap on harnessing the demographic dividend through investment in youth provide a solid policy framework and strategic foundation for youth engagement and for the development and active participation of this cadre of human resource and capital that is so critical for our development. They underscore the pivotal role of young people in the development of our continent. Let me end by reiterating that achieving Africa's transformational agenda will only happen with the full participation of Africa's young people. Youth must be active players in defining the health and development agenda, driving and participating in its implementation. This is the strong foundation required for Africa's inclusive economic growth, required for poverty reduction, required for peace and security, and required for shared prosperity. This new normal must safeguard the gains that we have collectively made in the fight against malaria and build towards elimination. I wish you all very fruitful deliberations as we commemorate World Malaria Day 2021. It is time that we all draw the line. Zero malaria starts with me, and zero malaria starts with you. Thank you.
Thank you very much, Ms. Joy, for getting us started on a very strong note. As you've heard, we are the driving force of the continent. That means the youth are actually the backbone of the socioeconomic development of Africa. And she has rightfully called upon us to ensure that we remain active and proactive, specifically in the fight against malaria. Thank you, Ms. Joy, for the opening remarks. For those who are just joining us, welcome to the session. My name is Whitney Mwangi, and I'll be your moderator for the session. I would like to hand over to Madam Sise. I'm not sure if she's online. I cannot see her, but we'll just give her 1 minute. Madam Sise, if you're online, over to you. All right, it appears that she's not on, so we'll proceed to the next agenda item, which is the plenary sessions. We do have a number of speakers. We are privileged today to be joined by very strong youth advocates who will be speaking to us about youth leadership to draw the line against malaria. And the question we're asking ourselves here today is, what can be done? We will have 4 speakers, and to lead us on is Ms. Desiree Matthias, the Namibia Presidential Advisor on Youth Matters and Enterprise Development. Ms. Daisy, welcome.
Thank you very much, Joyce. It's a pleasure to meet you. Sorry, Whitney Mwangi, and thank you to Ms. Joy for those opening remarks. Thank you for having me as a contributor to this very important and focused conversation. I work in support of President Geingob in achieving an inclusive, prosperous, healthy, united society. And health and well-being is central to our promise for prosperity. It's central to our objectives for social progress. It's central to securing a productive workforce so that we can propel our economic development agenda forward. So with those opening remarks, the war against malaria is one that is going to demand a comprehensive people-led approach. But in our context as African nations, it needs a youth-led approach because a young demographic majority has a meaningful role to play in the fight against malaria, especially in regions where the disease tends to be more endemic. In Namibia, our goal is to eliminate malaria by 2022, but as alluded to by the previous speaker, we're falling behind target. We're falling behind target even though we're signatories to the National Alliance of Leaders Against Malaria on the continent. We're falling against targets even though we have scorecards and strategic action plans and implementation plans to realize our goals. And I believe one of the key reasons we're falling behind target is because we're not effectively cascading the response to the community level, to the grassroots level, particularly in the regions where malaria is still endemic. In the Namibian context, we still have 10 out of 14 regions across the country that are endemic to malaria, which goes to show you the pervasiveness of the disease. So what are youth armies able to do in creating local chapters and collaborating with young people across the continent and the region in order to strengthen their capacities to respond? I think effectively deploying and deriving benefits from these youth armies, as envisaged by the patron of ALMA, will depend on 3 key aspects. The first one is about integrating our responses as young people into the national strategic action plans. For us to effectively cascade, there needs to be an integration of our activities with what the national agenda has set out to do. Secondly, it's about resource mobilization. A lot of the malaria responses at the national level have been underfunded. In Namibia, we are contributing 65% of our national response, but the shortfall of 35% is significant and is undermining our ability to reach zero new cases. Finally, it's about community and stakeholder mobilization to ensure holistic implementation, and young people have a big role to play. So in my view, youth leadership is going to be required as a comprehensive national, regional, continental approach. And we need to do a mapping exercise of who the stakeholders are. We need to identify who our complementary partners are. I think as young people, we don't have the capacity to do everything from A to Z, but we are able to provide some of the solutions. And I think we're able to do better when we leverage one another's strengths. This means identifying potential partners to create economies of scale. It's about finding who the subject matter experts are, who the academics and the health professionals are. It's also about identifying where the technology partners are, how to leverage artificial intelligence, who are the communication specialists, who are the mobilizers, who is able to have spaces and platforms to enable things like crowdfunding and resource mobilization. I think every chapter needs to be able to fill a piece of this puzzle so that we can have a more united, coherent, coordinated, and mainstreamed effort at national, regional, and then continental level. The beauty of technology is that it transcends boundaries. We're now able to have these conversations, unprecedented before COVID. We used to do a lot of webinars, but not to the extent that we have been forced to do by the pandemic. And I think there are great lessons in that. COVID-19 has not only caused governments to divert their public sector resources into the health sector and into technology. The benefits are that the resources that have been diverted to bolster public health capacity are also going to increase human resources, are also going to increase the capacities of communities to be able to respond not only to COVID-19, but also to non-communicable diseases like malaria. Maybe I should stop there and allow for other speakers before I take up too much time. Thank you, moderator.
Thank you very much, Ms. Desiree, for that comprehensive feedback and response to the question, what can we do? And it's very evident that community engagement and mobilization should be at the top of our minds, even as the youth, because a lot of times we leave this to the, to the leaders, the authority at the level of the ministry. And to hear you point this out outrightly, it's encouraging for us. So thank you very much. I would like to invite the participants to ensure they share their questions on the chat box so that they get live answers as we proceed. And as we've heard from Ms. Desiree, if you have any questions for her, be sure to direct them to her and she will respond to them. So I would like to move on to the next speaker, who's Ms. Tukia, a health research officer consultant at the Commonwealth Secretariat, who will talk to us through a couple of matters based on her experience. And really what we are looking to hear is what can be done at the level of her experience and expertise. Over to you.
Hi, thank you for having me on. It's a pleasure and it's an honor to be here with you all today and to really be part of this important event. I thought I would share based on some lessons on what the Commonwealth has done in terms of addressing malaria, why it's still a huge public health health priority issue, and also share in terms of what I believe youth can do across the globe, across Africa. So in 2018, Commonwealth heads of government, they made a commitment to halve malaria by 2023. Two indicators are used to measure the progress from a baseline of 2015, so looking at cases and deaths. And we are working in partnership with Malaria No More to create this dashboard in which it can help assist countries to monitor their targets, to identify areas of improvement, and to really ensure that they're keeping on track with the targets towards this. Now, in addition to the work with malaria and know more, what we have done as well is worked really in the past few years in the Commonwealth. Health Ministers meeting has focused on universal health coverage and focused on ensuring that people can have access to essential healthcare without suffering financial hardship. And in that, obviously, that means ensuring that there's access to malaria services and ensuring that malaria is targeted for their populations. In 2019, health ministers focused on ensuring that nobody was left behind. So that was addressing the vulnerable groups. And one of these vulnerable groups is women and girls. And again, we know that's a real priority population for looking at malaria, for addressing, to enable us to achieve these targets. And then following on from that, in 2020, the health ministers meetings, they focused on COVID-19 and focused on how we could really work to collectively address COVID-19 in the COVID-19 response, looking at solutions. So one of them was the formation of the COVID-19 Technical Working Group. Now, the focus of this is to really address COVID-19 collectively as a Commonwealth, but also the impact on other related diseases. Of course, malaria is one of them, and we have seen that the full extent of impact of COVID-19 on malaria hasn't really been captured yet, but we know that it is causing a big effect in our countries, especially in the Africa region. And following on from that conversation as well, there was the development of the information and price sharing database. Now, this information and price sharing database is brilliant because what it does, it captures the full range of the Commonwealth countries to have a way of sharing information, to sharing data on supply chain systems, on pricing of medications, of real-time data of where there could potentially be stockouts. And the benefit of this is that, we'll be able to look at essential medicines and things for and disease and medicines for malaria and things like that. Now, these are some of the things that came out of the 2020 Health Ministers meeting. Now, 2021 Health Ministers meeting, which is in a month's time in May, that will focus on sustaining the health gains. And again, malaria is so important to this conversation because despite this pandemic, how do we sustain some of the gains that we are making? And again, the work that Malaria No More has done and showed, how can we ensure that we're reaching these targets and moving forward? The other platform that, the health ministers meetings allow for is that exchange of best practice. So in and amongst countries that have been dealing with the pandemic around the Commonwealth, but at the same time, they've been needing to look at malaria, look at their access to essential medications, look at their vulnerable groups. The Commonwealth Health Ministers meetings allows countries to come together and discuss what is happening across the region, what is happening in their countries. And I guess just to highlight one example that was recently brought to light with some Commonwealth countries is the Elimination 8 initiative, a great initiative of Southern African countries to tackle malaria and coming together to kind of share, across the region what they can do to work together. Now, this is a sort of best practice and sharing that the Commonwealth Health Ministers meeting allows and facilitates. The other areas of work that I can share on is AMR, the Commonwealth Partnership for Antimicrobial Stewardship. We know, again, this is a huge issue, AMR and malaria. If we are to reach our malaria targets and goals, is to look at AMR. And there's been quite a lot of work that the Commonwealth has been doing in this region, and also working with civil society organisations such as Commonwealth Pharmacists Association, the Commonwealth Health Professions Alliance, of which a lot of young people are part of. So these are some of the areas in which that the Commonwealth has looked at in the past few months and years. But what I can say in terms of mobilizing young people to kind of really really take this issue on and to just be re-energized is on two fronts. Firstly, we've got the Commonwealth Youth Awards. Now, the Commonwealth Youth Awards is a platform and a forum where the best sort of innovations around the Commonwealth can be shared and brought to light. The last winner for the Commonwealth Youth Awards was in the Africa region, and for health was announced in March. But one of the finalists was from Kenya. Now, his innovation was focused on blood donations, and he's done some brilliant work. His name is Abdul Rahman Alwi. This year, I would encourage all youth, from around the Africa region to apply. They launched on International Youth Day in August. And again, to bring the innovations forward of what they are doing in malaria, to really get that recognition, support, mentorship, and to share best practice of what they're doing across the Commonwealth. Now, just as the last presenter spoke, what I can say in terms of encouraging our young people to really take this on is to join in the advocacy and the policy discussions around universal health coverage, around addressing out-of-pocket payments associated with malaria, having discussions on resource mobilization, discussions on how we can employ a whole of government approach. So whether it's, discussing how we can bring the health ministers together, education ministers, ministers of finance. Again, I would also say multi-sectorial working, because there is a policy, there's the policy side of things, but also the advocacy side, which is just as important, the community engagement. Wherever our young people are based, whether it's through faith organizations, private sector, civil society, it's about joining the dots together, partnering with organizations through MOUs, through letters of agreement to showcase that recognition of how you're aligning strategic priorities, but then also doing that grassroots level work together. And I would really strongly encourage that we bring our young people and ensure that our young people are involved in the COVID-19 recovery and really being able to talk about the impact of malaria and discuss this. I think I'll nearly stop there. I've just got one more thing to say, which is really quite important. We know that heads of states are meeting this year in June under the theme Delivering a Common Future. And in the sidelines of this, we're having a summit on malaria and neglected tropical diseases. So really, this is another opportunity where youth really need to be involved. We want youth to have a platform there to really, this is about re-energizing our efforts and our commitments to malaria, and to ensure that youth are at the table, they're at the policy discussions, they have that platform in which they can galvanize that political support, and also to gain the sorts of attention where we need young people, youth to have their youth-led initiatives funded and supported, because we know the Commonwealth is made up of 60% youth, and they have a huge role to play in eliminating malaria and ensuring that universal health coverage is attained. So I'll stop there. Thank you very much, Whitney.
Thank you very much, Ms. Tukia. I hope we can all at least unpack a couple of recommendations from Ms. Tukia, very rich and comprehensive provision and inputs into this conversation today. And it's interesting to know that 60% of the Commonwealth is actually made up of youth. So that's a lot of opportunity, and especially on the frontier of information sharing, as you rightfully mentioned, knowledge is power, that we cannot argue. And I hope that we'll have more opportunity at the summit to interact and get to know the various initiatives and interventions through which we can exercise our, our strengths as youth to advance the fight against malaria. Thank you very much, Ms. Tukia. I will move on to the next speaker, who is a doctor and a youth champion. So she can tell us more about the work that she does. and specifically lead us into insights on what interventions that she thinks or believes that stakeholders can do to facilitate youth leadership to draw the line against malaria. Dr. Difanji, over to you.
Thank you very much, Whitney, my fellow panelists and the audience. Happy World Malaria Day in advance. My apologies, I'm actually in the rural parts of Malawi and I'm struggling with my internet today. I believe that we do not just need to, there's so much talk about having a youth army, but are we equipping this youth army? Because it's one thing for stakeholders, for the government, for the private sector and the non-governmental organizations to talk about having a youth army, but what actually are these stakeholders doing to equip the youth army? Because if you want to send out your soldiers into war, you're not going to do that if you do not equip them to go into war. So I believe that stakeholders have to be intentional in engaging the youth. You know, we talk about, oh, give us a seat at the table. We need to create space for the youth at the table. I believe that stakeholders have actually managed to create a seat for the youth at the table, but these are actually temporary seats. These are actually face value seats. So we're given a seat for a moment, but we're not actually left there. We're not actually left to permanently make the decisions. So I think that we do not just need to lend the youth seats at the table, but we should actually give them permanent positions within our organizations, within the various programs that we're doing, for them to be able to implement youth strategies. You know, I have been a part of these webinars. I was part of the CHOGM 2018 in London, and we had the first ever malaria summit, but one would tend to ask, how many countries or how many organizations actually took it up after that summit to engage the youth? You know, it's going to be an interesting statistic to find how many actually took it up, you know. And Malaria No More UK is one of the organizations that has really embraced the youth. I mean, from the Malaria Summit in 2018, I was appointed the Malaria No More UK Youth Ambassador, which is one of the ways that they're doing to have youth engagement, to have a youth voice. But I think it's beyond having a youth army. We need to equip the youth army. You're not going to create a team of advocates if you're not even training them in advocacy. You're not going to say that, oh, we'll give the youth a table for this webinars, for this particular event, then what? What happens after that? So I think stakeholders have to really be intentional, and they should not just do things for the moment, but they should actually be intentional in putting it in their company policies and strategies in having youth engagement. We need stakeholders to create intergenerational engagement opportunities. So adults need to know the value of sharing their knowledge with the youth. We need to have adults to contribute with the youth and to share together with the youth. But also we need to have youth-centered events. And these youth-centered events should have the support of organizations like the ALMA, the Commonwealth, so that the youth are able to amplify their voices, to be able to amplify the things that they're doing. Because there's a lot of things, Whitney, that the youth are doing on the continent, but they do not have the platform to be able to showcase all the work that the youth are doing. And, you know, last but not least, I also feel that it's very important for the stakeholders to build critical spaces for youth engagement. And I'm talking about youth-led work. You know, should be able to have special grants just for the youth initiatives. We should have the right infrastructure and the right economy that can be able to allow the youth to implement their interventions, to showcase what they can do in this fight against malaria. I think I'm going to stop there for now, Whitney. Thank you.
Thank you, Dr. Difanji. We can all sense your passion on the matter, and I agree with you. It's not just about having the seats filled and the tables with representatives, but also making sure that we build the capacity of the youth. And perhaps I could ask you to share with us more on which areas that you believe the youth should be supported. You've talked about advocacy, you've talked about being given the platforms, and I'm just curious, is there more that can be done to ensure that the youth are effectively involved in the campaigns?
Yes, Whitney, there is more. We need education opportunities. You know, we need to create scholarships to be able to allow these youth to further their studies in research, in innovation. I mean, there's so much that you can do, but you also need to be educated to be able to do your things with evidence-based. I always believe in evidence-based interventions and practices, and we need to create those education opportunities. We need to tackle, unemployment is a very big thing in Africa. Unemployment and underemployment is a very big thing in Africa. Until our leaders address that, we're not going to expect the youth engagement that we want. Whitney, if I do not have shelter, if I do not have food, malaria is the last thing that I'm going to worry about. So we need to make sure we tackle underemployment and unemployment. So the leaders need to intervene in that sector as well. Open up grants for the youth. Be specific on the age groups that can apply for particular grants to give the youth a chance. You see all these fancy grants being opened up, but the sort of criteria that is being used to even give those grants is already restricting and limiting for the youth. But if you are intentional in your criteria to just want to fish out the youth, to give them the opportunities, so open up campaigns, that's research campaigns, youth-led campaigns, increase funding around those initiatives. But also we need to encourage partnerships. As a youth leader myself, one thing that I've learned in this fight is that the youth like to work in silos. So everyone is doing their own thing in their own space, but we need to map out the youth leaders on the continent and find a way of bringing all those people together so that they can be able to combine their synergies and also to just enjoy the power of group work, because I believe that together we can. But on our own, it's going to be a hard fight to win, but together we can. So last but not least, we have seen the Draw the Line Against Malaria campaign. That campaign is basically embracing the power of art and culture. So I think one of the things that our leaders also need to invest in is art and culture, because that is the way our people understand issues. That is the way we communicate as an African continent. So one of the interventions that we need to do is also invest in art and culture on the continent. And that is going to help us go a long way in the fight against malaria.
Dr. Defanji, you raise a very crucial point on the aspect of social determinants of health. And truly, if one is hungry and they have other needs which they consider essential, they will not be having malaria at the top of their minds. And so it's an honor for us at the continental level, not just as youth, but leaders in different capacities, to ensure that we are balancing out all the needs of our communities. You talk about the integration of art and culture into the malaria response. Are there other interventions that you've seen working that you believe the partners, the youth on here should take on to improve the response?
Thank you very much, Whitney. Like I said, the youth are doing a lot on the continent. There's so much that the youth are doing behind the scenes and in front of the scenes. But like I said, we do not have the right platforms to communicate and to publicize our works. So, the youth are increasingly working through the digital innovations, the digital space, the power of Twitter, the power of TikTok. We have seen how the youth are using that to spread awareness about malaria, how the youth are sharing interventions around malaria. So those are some of the things that the youth are doing. We also have the youth that are championing science and education through research and innovations. One of the speakers was talking about the Commonwealth Awards and, the innovations that are given through that. We see that the youth are actually going a step further, because if we're going to win this fight against malaria, we have to make sure that we are steps ahead of this parasite. Otherwise, we're not going to win. So we have the youth that are working in research and innovations. We have the youth that are working in the front lines as medical doctors. We have the youth that are working in the front lines as advocates like myself. So, the youth are constantly calling our leaders to be accountable, because like we're saying, we're no longer the leaders of tomorrow, but we are the leaders of today, but tomorrow is ours. We, the youth, are the ones that are holding our leaders accountable, demanding accountability from our leaders to mobilize resources to fight against malaria. So a lot of people have had malaria, and unfortunately, it is actually the norm. You're at work and you just get a message, oh, I'm not coming to work today because I have malaria. The youth have disproportionately been affected by malaria. The youth, under 5 children and pregnant women have been disproportionately affected by malaria. Every 2 minutes, a child is dying from malaria. This is not normal. This is not normal. Malaria should not be accepted. And I believe that united, the youth are going to end malaria. United, we are the generation that is going to end malaria. Thank you very much, Whitney.
Thank you, Dr. Ndifanji. And you've heard it, ladies and gentlemen, it's clear. We have a responsibility as the youth to ensure that we take on the mantle of being upfront, being clear, being visible in the malaria response in Africa. And as the previous speakers have reiterated, there is a lot that we can do. There's so many opportunities for us. We just need to put ourselves out there and ensure that we are taking this on confidently and with the boldness that is required. I would like to remind the panelists and the attendees to interact on the chat box. I can already see a number of questions. Let's ensure that we keep the conversation going even as we listen to our panelists. I would like to welcome a member of the ALMA Youth Advisory Council. And for those who are not aware of what the ALMA Youth Advisory Council does, it's a group of very talented youth who are passionate about the malaria response, who have been nominated to represent the different regions of Africa and ensure that the voices of the youth are heard at the continental level and are adequately represented. And the next speaker happens to be the chairperson of the ALMA Youth Advisory Council. In another life, perhaps in another context, we would play the national anthem, but since we don't have one, allow me to welcome Mr. Alois to share with us his experience on malaria and tell us how young people can come together and ensure that the movement towards a broader fight against the end of malaria is not just happening, but consistent through the months and the years. Welcome, Alois.
Thank you, Whitney. I'm really happy to join this meeting. Thank you very much for other speakers. I really applaud the points made by the previous speakers, especially those by Dr. Ndifanji, a really malaria advocate and youth ambassador. She really speaks for the youth. The voice is really the voice of the youth. That's the kind of advocates we need. Those are the kind of points we need on table so to ensure meaningful engagement of young people. As introduced, my name is Alois Urasa. I'm a chairperson of ALMA Youth Advisory Council, and our role is to strengthen advocacy at continental level to ensure meaningful engagement of young people in the fight against malaria. Our role is to call for accountability and to call for action from our leaders, to call for political will to end malaria. As you know, there is nothing that can be driven at country level or at even continental level if there is no political will. If our leaders are not ready to initiate changes, if they're not willing to do things or to support interventions against malaria, then there is nothing that will be done. So we need, our role is to ensure that there is that political will to fight malaria, is to ensure that there are right policies and policies which are realistic in the fight against malaria, but policies which are equitable and ensuring equality for all people, equality for all kinds of youth from different social backgrounds, and to ensure that every person has a voice in the fight against malaria. I love the point made by one of the participants that young people, the engagement of young people should be intentional and really, and that's the work we are doing as Youth Advisory Council at ALMA to ensure that when we're engaging the young people in the youth army, it's a really and intentional engagement to ensure that they're going to be supported, to ensure that there is platforms for them to build capacity in advocacy, build capacity in understanding and supporting the interventions to fight malaria. But to my own experience, I've been a youth leader for health in the fight against malaria. I was trained in advocacy and health system strengthening by Results UK and partners to fight malaria. And we were 25 young leaders from Africa. We were trained and deployed into different areas at Tanzania, Ghana, and Sierra Leone. When we have been doing a lot of work, we've been doing a lot of campaigns. And one of the campaigns was the Beat Continuous campaign, where we're beating the drum to call for attention in the fight against malaria. Another campaign we did was Happiness, My Happiness video. On the World Happiness Day, we created a video to show what happiness means for people, especially when the world is free of malaria. We hope that when people are free from malaria, they're free to work, they're free to build, to work in other socio-economic activities to strengthening their family relations and so on. When people are healthy, their wealthy is nearby. They say health is wealthy. But another thing that we have been doing with Malaria No More UK as well, with Undefined and other malaria champions, we created, we worked on the Draw the Line Against Malaria film, which is going on now and will be also showcased on it during the Commonwealth Summit, during also the Malaria Summit in Kigali. This is the campaign that is that was really had a great engagement of young people to show the power of young people in the fight against malaria. We had all kinds of youth, we had children, we had primary students. So that was just to show how stakeholders are ready to engage young people in the fight against malaria. We believe that young people have great potentials, have really a great and immense power to fight malaria, and they have to be supported. They have to be supported, not just to be taken into simple activities like one of them said, not only to come for ticking the boxes, but they should build the boxes to be ticked. Another activity I've been doing with the stakeholders was with Rotary International, and I'm happy that before this year, 2021, the young people in Rotary could not be able to apply for funds unless they are partnered with the elders. But I'm happy that Rotary has agreed to change their policies, and from next year, the young Rotary members, they are called Rotaractors, can apply for even the global funds and one of the focus areas is disease prevention. So stakeholders are ready to engage the youth and meaningfully engaging them. And I've been the beneficiary of the engagement from the Rotary, where I've been supporting the communities in the fight against malaria, specifically in providing mosquito nets. Last year, we were able to provide mosquito nets for the boarding school students as Rotaractors, and we also trained them in malaria prevention. Also, we trained them in other diseases like also important health aspects like sexual reproductive health, which is very important for young people as well. But this year, again, from tomorrow, we are going to supply other mosquito nets as young people to the community. And the coming month, we are also going to supply over 1,700 mosquito nets for the community. This is just an initiative from the young people within the Rotary organization. So there are many other organizations, like we have the ALMA, where we are speaking now. This is an event which is prepared by young people themselves. And this is just a way forward to show that young people have the power, and we are going to build platforms for young people to speak, to raise their voices against malaria and other health outcomes. As Dr. Nipanch has mentioned, that we don't have the specific platforms to raise our voices. And ALMA is going to build one, has already started building one. And this is, we have the Advisory Council, and we are going to have the youth armies for all member states of ALMA, 55 member states. Kenya has already started, and we are going to move into other countries, ensuring that young people really have participation in the fight against malaria, neglected tropical diseases, and other disease prevention programs. Another thing I've been doing as a malaria advocate is to train community health workers. As health laboratory science student, I also teamed up with other malaria experts, and we trained community health workers in different regions of Tanzania, and we are looking forward to train more. I'm happy that there's even more funds in Zambia to train community health workers provided by Bill and Melinda Foundation, Malaria Partners International, and Rotary International. I'm happy that this is to show that everyone has a position to fight diseases in their area. Young people have their position, and the community at large have their position. So engaging them, building capacity, training them is very important. And this is a key to fight malaria. But another intervention that I've been engaging with is research. Currently as a finalist in health sciences. I'm conducting a research to study transmission blocking stages of malaria. We are going to study gametocytes and contributing to science in the fight against malaria. I know there are so many young people in the areas of science who can do more than what we are trying to initiate. For young people who are here interested to join ALMA Youth Armies, keep your eyes in our website. It's still under development. The youth strategy will also be there. Check the processes and the qualifications. I think the qualifications just to be a young person and ambitious in the fight against malaria, and other qualifications which are realistic and relevant for young people. So we really welcome you, and we hope that we are going to beat malaria as we have targeted. Thank you. Let me end there.
Thank you very much, Alois. And if anyone in the meeting for a moment there was asking themselves, where do we even begin as youth? And what are the respective aspects of the ongoing interventions and initiatives can we be part of? Alois has turned that into reality. We see he's in science, he's in research, he's in the community work, he's involved at the continental level. So it's a reality. It can be done, and I hope that his contribution has encouraged each one of you, especially on the aspect of joining the youth armies. This is an initiative that is being spearheaded by the ALMA chair, His Excellency Uhuru Kenyatta, who's the President of the Republic of Kenya. And the vision is to promote innovation, research, development, and ensure that the malaria advocates that we are working with at the level of the ALMA Youth Armies are empowered enough to take on this responsibility. So thank you, Alois, for inviting other youth to be a part of this. And I hope that indeed everyone who is interested will take note as he has directed us and ensure that we are all joining forces and rowing the same boat towards the end of malaria in Africa by 2030. I would like to go back to one of our panelists, Ms. Desiree, who will share with us her last remarks before she has to leave the panel discussions. Ms. Desiree, over to you.
Thank you very much, moderator. And I really want to commend not only the convener of the meeting, which is young people, but also the previous speakers who have brought a lot of experience, insight, and a lot of passion in the work that they're doing to progress in our goals towards ending malaria. You know, I tend to resonate with the intervention of Dr. I don't want to pronounce the name, I might get it wrong, Ndifanji, who spoke so passionately, and you can see she spent a lot of time and invested in advocacy on malaria specifically, and she's a subject matter expert. I would like to make my final intervention as a pledge, you know, to not only to reaffirm commitment as a policy advisor within government, specifically to our president, but also to make a commitment that as Namibia is mainstreaming youth issues, to put them at the heart of development, that malaria is one of the central themes as well. I agree that it should be beyond rhetoric. It really needs to be practical. It needs to be pragmatic. It needs to be evidence-based, and it needs to be supported with resources if we're going to realize any kind of achievement. But you know, youth matters are not homogeneous. Youth are not homogeneous. There are so many issues affecting young people, and the spectrum is very broad across the thematic areas. So I also just want to encourage you to say, and it's something that I say often on record, that even if you don't see a policy that explicitly states young people, it doesn't mean that the beneficiary is not going to be a young person. When we do well in our countries to intensify investments into health, investments into research and development, investments into education, skills training, those are benefiting a predominantly young population, using Namibia as a case in point. And I do think that there is a space for ALMA youth armies. I think it's not just rhetoric. I think you are going to need to have to create a space to champion specifically work on malaria, or risk it being absolved into all the other health and social welfare related issues of young people. I commend the work that you're doing, Alois, to maintain the focus specifically on malaria. We have done a lot of work in co-leadership and mainstreaming young people into the national governance structures and placing them into institutions and giving them platforms and seeding them into parliament to become lawmakers. And what I'm committing and pledging and reaffirming today is my intention to make sure that our young leaders who are making policy, myself included, who are formulating the laws of the country, are committed also in the fight against malaria. Namibia has got some good case studies in terms of the work that we're doing with our community health workers that we're deploying into the regions at a community grassroots level. These are young people. These are young people who are doing the testing, they're doing the campaigning, they're doing the case management, they're doing the spraying in the homes. So even without saying that we have a local chapter of youth armies, I kind of want to share the experience that these things are happening as part of the development process and delivering equitable public health services to Namibians. And I'm sure that our case is not unique across the continent. So I just wanted to encourage you to say that it's going to be a process. I'm refreshed by the agency. I'm refreshed by the passion. I'm refreshed by the targeted and focused approach that you're taking to tackling malaria. It's very necessary because there are so many other issues that are pulling us apart and diverting attention and diverting resources. But to move the needle, it's not going to take much, but it will need a concerted whole of society approach. And I would just sign off by reaffirming my personal commitment as a representative of young people, but also our country's commitment to mobilizing the resources and implementing the programs so that we can reach 0 cases by 2022, which is our national commitment. Thank you and congratulations once again for your leadership.
Thank you, Ms. Desiree, and we thank you again for making time to be with us and adding insights into what you had already said. We look forward to seeing and receiving from you more information on opportunities that you have on how we can leverage the expertise that you have at your level to ensure that we just strengthen the leadership, as you have mentioned. Thanks again. Ladies and gentlemen, we have come to the end of our first session of this very insightful webinar, the panel discussions. And I hope that you can take a few of notes and action points for you that will instigate you to go in the right direction towards being more involved and again, proactive in ensuring that the youth are heard very strongly in the health sector and specifically in the malaria response. I would like to invite Dr. Margaret from the African Union Commission to give us a word, since she was not able to speak with us at the beginning of the webinar, but she has been following the conversation. Dr. Margaret, welcome.
Thank you very much, Whitney, and good afternoon. And permit me to stand on all existing and established protocol, but particularly to use the moment to address the very dynamic young people that I've heard speaking this afternoon. As a former clinician myself who's seen many babies die from malaria, it's really exciting to see and hear to the extent to which the advocacy to fight malaria has moved outside of the clinical space and it's actually being led by young people. And I was quite excited when somebody mentioned Rotract, because I used to be a member many years ago. And to see now that it has evolved to an organization that can actually put in a bid for global funding is quite exciting. I joined late because I was tasked very late by my director, Mrs. Maria Masisi, to attend this webinar on her behalf. So I bring you her greetings as I read her statement as follows. I am pleased to join the partners of the Africa Union Commission and young, vibrant advocates for a strong malaria response in Africa today as we commemorate World Malaria Day 2021. I wish to start by thanking ALMA for taking the initiative to harness the potential of young people in strengthening the fight against malaria on the continent. In 2020, His Excellency Uhuru Kenyatta, the appointed Africa Union champion for malaria, launched the Digital Malaria Youth Army. With your support, his vision for systemic youth involvement in existing malaria elimination initiatives across the continent will become a reality. The Commission welcomes opportunities to engage with ALMA Youth Advisory Council on upcoming befitting events such as the International Youth Day 2021. I wish to thank all partners involved in making this virtual forum a success. The collaborative effort among partners involved in the malaria response is evident. I encourage the continuation of the same, especially during this time when we are also battling the COVID pandemic. Young people in particular, the youth are the driving force for Africa's sustainable economic development. It is vital to invest in Africa's rising generations to achieve historical milestones as we march towards eliminating malaria by 2030. The youth have vast potential to contribute significantly to the fight against malaria because of their large numbers, energy, innovation, creativity, and potential to influence. The Africa Union Commission has set clear priorities with matching bold and ambitious targets to fast-track the end of malaria in the next 10 years. The Africa Health Strategy and the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030 provide the broader framework within which this breakthrough will be attained. These policy frameworks also call for investment in youth and adolescents as an intelligent, pragmatic economic intervention with a high return on investment. Specifically, they identify the need to empower youth with skills and knowledge to attain good health and prosperity in the context of the African Union's Agenda 2063 and Agenda 2030. The health and well-being of adolescents now and in their adult lives greatly depends on key education opportunities that will help them stay empowered and demand rights. The Africa Union Commission will continue to strongly advocate for increased initiatives that lead to youth empowerment to lead the fight against malaria. If the youth are to draw the line against malaria efficiently, the process of self-examination within themselves must be done to ensure that indeed zero malaria starts with each of them. The findings from a survey conducted by an AU partner named Rollback Malaria Partnership in March 2021 show that the youth in Africa are involved in the Zero Malaria Starts With Me campaign. The survey also showed that many of them already take preventive measures to protect themselves and their families against the disease. Others are willing to volunteer their time to support malaria control efforts, such as distributing bed nets. Some youth share information about malaria on social media, hoping to make a difference by calling on national policymakers or engaging community leaders to prioritize malaria. In conclusion, I encourage all young people in Africa to fully take on existing related opportunities and bring new ideas for malaria prevention and control to the front line. Your ambitious action is the Africa-led transformative change the continent needs for well-being and prosperity. The Commission hereby reinforces commitment to full and fruitful cooperation, and I look forward to an impactful engagement during this session. I wish you all good health. #ZeroMalaria starts with me. That's the end of my director's statement, and I wish you fruitful deliberations. Thank you.
Thank you very much, Dr. Margaret. And ladies and gentlemen, there we have it, the support of the Commission and a strong word from them that we have the backing of policies. We have other youth in Africa who are doing more at the level of, at the clinical level, at an advocacy level. And so I hope this encourages us to ensure that we are following through and we are also bringing ourselves to the forefront, our ideas, innovations to ensure that if we have the backing of the leaders, that they find us ready, they find us willing to be a part of the malaria response on the continent. So I'd just like to go into the questions. We do have a couple of them, and I thank you for those who are submitting. I encourage those who have thoughts and ideas and they're not tabling them to share them with us so that our panelists can address them. I will pick out one question. It's from Nelson, who's a final year medical student from Makerere University in Uganda. He says he is glad to be here and inspired and asking how he will join ALMA. I will direct this to our Honorable Chairperson, Alois. Over to you.
Thank you, Whitney. Thanks, Nelson, for such a wonderful question. Welcome to ALMA. You can visit our website. That's alma2030.org. There's a lot of things to engage. There are some trainings on scorecards and a lot of issues to engage. You can engage with. But furthermore, we have one of our members in the Youth Advisory Council who is from who is a representative of East Africa, is from Uganda, Brian Gita. We can keep you in touch so that you can even learn more about ALMA. And I think also soon we are going to have the youth armies, and it can be another opportunity for you to engage with ALMA. Welcome.
Thank you very much, Alois. And indeed, now we know that in the era of being in lockdowns, the digital arena has really been revamped. And so the websites, social media platforms, as Alois has directed, please be sure to check what ALMA is up to, and the opportunities will be before you on your screens, and we look forward to hosting you. I will move on to the next agenda item. We have a very lovely and impactful video that the ALMA Secretariat is going to show us today regarding drawing the line against malaria.
Malaria, we won't let you steal from us anymore. We are the generation that can end malaria.
Malaria, we are too strong for you.
We're too bold for you.
Malaria, we are too fast for you.
Malaria, I don't like you. Two-Face. Too smart for you. Malaria, don't even dare take our future with you. Malaria, you can't stop us. Nothing will keep these lines from growing. We are the generation that can end malaria. future back.
Indeed. Thank you very much, Alma. We are the generation that will end malaria. And if you're a creative or an artist out there, I hope this video has shown you that there's no limit to the people who can join this movement to malaria. On there, we had a long distance runner, Eliud Kipchoge. We had a rugby player, Sia Kolisi. And so the opportunities are endless. And you can be a journalist, you can be a student, you can be a teacher even beyond the clinical aspect of malaria and bring on the talent and the abilities that you have so that we can improve the pool of expertise and advice and counsel really that we have at the table guiding the response to malaria. Thank you very much to our panelists and our attendees for being patient with us and getting through with us to this point of the agenda. I would like to move on to the next session, which is really the last session. And the next speakers are going to bring it all together. We have heard a lot from the questions in the chat and from the panelists and the opening remarks that have been shared. So these speakers are going to take us through some of the recommended actions based on their experience and based on the sharings that we have heard on this call today. I would like to welcome Ms. Winter Okoth, who's a champion with the Nothing But Nets initiative. Welcome, Ms. Winter.
Hi, Whitney. Thank you. Thank you so much. Can you hear me? Hello?
Yes, loud and clear.
Okay, thank you. Thank you, Whitney, and thank you, Alma, for this invitation to be part of this amazing panel, and also part of the powerful conversation that's going on. Just to briefly introduce myself, I am a scientist involved in malaria research for a while now, and I'm also passionately engaged in advocacy with the Nothing But Nets campaign as a malaria champion. My fellow panelists have touched on really major key points, and that it's been a really powerful, inspiring conversation. And I would just want to stress on a few pointers, such as the need to better equip youths for a meaningful participation, because we know that youths, they are the promising generation of change makers, and they're yearning for meaningful representations. And today's African youth are very eager, to be represented at all levels of decision making, to partake in making a difference in their communities, in their nations, and globally. And as we know it, that African youths, they make our continent a powerhouse of future economic growth and innovation. And so to support our generation to lead the fight against malaria, I think our leaders should ensure there is meaningful inclusion of youths in malaria leadership, policy making, research and development, here including STEM empowerment, for instance, advocacy platforms, public health empowerment, and the various ways that youth can take lead in this fight. Some of the key pointers are like taking lead in advocacy, for instance. And advocacy is a powerful tool because it allows you the chance to use a voice and find a way of sharing your thoughts and opinions about this fight and trying to action that by reaching out to the government leaders, for instance. And you can do this through campaigns, platforms, meeting with members of parliament, community leaders, and all these barazas, back at home in Kenya. So if there are barazas in whatever county you're in, for instance, I'm from Kenya, and you can find a way of just reaching out and attending these barazas and giving your thoughts to the chief, of the village, or to the any other leader or authority in that region or area where you are. When it comes to taking lead in communication that leads to action, again, this can be done through written communications, like writing opinion letters, opinion articles, targeting a greater audience, and specifically the young people and our leaders and also stakeholders. One of the panelists talked about finding a way of incorporating art and culture. So like we just saw in the entertainment, through music, how can you incorporate that and send the message through poetry, science communication, both at national and global stage. Also using the social media channels. I think social media, at some point, there are people who underestimated the impact of social media, but it's become a really powerful tool that if we know how best to utilize it, and if youths are equipped with the resources and even trainings on how best to use their social media platforms to actively engage in the fight against malaria, not just malaria only, but championing other issues that are going on in their countries and worldwide, like climate change, for instance. Using other, conventional media platforms like television, radio shows, finding youths who can develop content, that's focusing towards driving the message about the fight against malaria. How can they come up with shows, TV shows that can glue the youth so that they can understand the message. They can understand what is malaria, how does it get transmitted, how can you prevent it, what are some of the tools that we have at hand to prevent this disease. So if we have such kind of shows, whether it's in a radio or a TV, to help disseminate the message to the broader targeted audience, that would help. When it comes to taking lead in community level action, again, this, my fellow panelists have touched on this a lot, and you can have things like, organizing community wellness programs, fostering, public health education, touching on mentorship, empowering community health workers, engaging into door-to-door initiatives to create awareness. And also, I always really stress on this last point, schools and university student clubs, because we have all these clubs at the uni or in high school. How can we find a way of them organizing programs under the patronage of their teachers so that they can reach out more to their communities where they're based? And also when it comes to taking the lead in innovation, we know that young people are engaged in different fields of expertise. We have young people who are scientists, public health professionals, you have educators, you have medical doctors, you have artists. So finding a way of supporting them and making available the resources that they need and equip them with the right skill sets that they need in order to achieve that. So for instance, to speak on behalf of scientists, it will be really nice if governments can always find a way of allocating budgets for supporting R&D, with research. And all these grants, like one of our fellow panelists talked about, it can be so hard for a young person when you're writing a grant in order to work on a particular research within malaria, for instance. And it's very competitive out there, and that it makes so many young people don't want to go further into doing more researching because they'll feel like it's a gamble, like how will I get funding to support this idea that I have so that I can do this research, right? But if you have scientists who are also championing this fight through better understanding malaria disease, what are some of the innovative tools that we can come up with in order to prevent this disease from spreading and hopefully eradicate it for good. And I think these are some key pointers. It's not just a matter of having these webinars and talking about it, but it's a matter of how can we channel it so that they're actioned and the leaders really take action, because it will be a pain if we keep on talking about the same things 5 years from now, 10 years from now, and there's no implementation, there's nothing happening. So that's where I agree with Dr. I don't know if I'm spelling her name right, but yeah, the doctor who spoke before, yeah, that was really powerful. That was really powerful. Yeah, thank you. Thank you. Yeah, that was really powerful because we need to see our leaders take action on all these things. We need to see them acting on all these ideas that we put on the table. When we reach out to them and you see youths reaching out, going to the parliament, for instance, trying to talk to members of parliament or even to the president, we need to find a way of just them making a commitment and saying, yes, we're going to do ABCD, and what is the goal, what is the timeline of achieving those commitments, so that we know, oh, next year, this is what we need to achieve by next year. So when they have a good strategy on how to accomplish all these things, and I'm so grateful for ALMA, because I think it's a really wonderful platform, and it would be nice if there is a timeline for each country involved in ALMA, if they can come up with a timeline to say, okay, this is what we will do, and we want to achieve this by such a date, in terms of getting youth involved in this fight. Those are my points. Thank you so much.
All right, thank you, Ms. Winter. And it's good that you reiterate a lot of the comments and the recommendations that have come from the other panelists, to mean that we are all in the same headspace. The one thing that we need now is ensuring that all the commitments have been turned into action. Thank you for that. And I hope that the youth who are here interested in what is happening at the continental level within the context of malaria are going to take that on, and we'll see more of youth presenting themselves. I would like to welcome the next speaker, Mr. Michael Corsa, who's a youth leader for health, to share his set of recommended actions. Mr. Michael, over to you.
Hello, good afternoon from Ghana. My name is Michael, and then I'm a youth leader for health. Just as the ALMA Advocacy Council Chairperson, Alois. So I wouldn't say a lot about youth leader for health, because Alois said a lot about it. So I will just start with the issue, or the fact that RBM partnerships says that 9 to 10 African young people are ready to take action or draw the line against malaria. We have almost 2/3 of Africa's population who are doing something about malaria or advocating about malaria. I personally can talk about Youth Leaders for Health program, the ALMA Youth Advisory Council, and then the RBM Youth work stream. I'll use the Youth Leaders for Health as case study, because that's where I was a lot. In advocacy, in terms of advocacy, the Youth Leaders for Health program had 25 youth leaders from countries like Ghana, Sierra Leone, and Tanzania, all being taken through advocacy training in Addis Ababa. And then when you come down to Ghana, we have like 11 of them in Ghana, and then we are spread in the old 10 administrative regions of Ghana. Now the administrative regions of Ghana are 16. So the Youth Leaders for Health program, when at the regional level, that is in terms of the African concept, we were at the deputy chairperson of the AU Commission to submit a communique to him during the 2020 AU Summit. We also had key advocacy moments, like the Ghana team, after the submission of the communique in Addis Ababa, we went to the embassy of the Ghana embassy in the Ethiopia to also submit a communique to the ambassador over there. when we come to in terms of communication and then taking the lead, I think my previous panelists also had talked a lot about submitting letters and all of that. In the Youth Leaders for Health program, Ghana, for instance, we submitted a couple of communiques to the health ministry, to the health ministers. When it comes to the regional level of Ghana too, we submitted communiques to the health directors of each region where we are represented. We also had a chat with political leaders ahead of the 2020 elections to task them to involve or include malaria and then young people involvement in their planning and then in their manifestos. When it comes to community level action, as I mentioned, the fact that we are also divided into, or we have a rep in each of the 10 old administrative regions of Ghana. We had the opportunity to partner with or work hand in hand with the regional malaria focal people or focal persons to have talks, do activities in terms of malaria in our various regions. And then we also had the opportunity to educate or recruit what we call the second generation youth leaders for health in our various regions. So we saw the need or the importance of having young people in the grassroots to do advocacy in the regions. So when it comes to the national level, and then we come to the local levels, that's in the regions and then in the communities that we find ourselves, we also brought up young people who will join us in advocating for improved health systems and then increased domestic funding for malaria. In terms of innovation, we can count on so many innovations that young people are bringing up. Think the previous panelists have said a lot about innovations and all of these things, but then I think that when it comes to the grassroots as well, we can have small innovative ideas to ginger young people in terms of getting people in their communities to use these innovative products that we've engineered or we've created, so that it will also reduce the malaria burden. For instance, when we talk about the insecticide-treated nets, a lot of people say it's uncomfortable and this and that and that and that, but then they don't know how that is very important in helping in reducing malaria burden when it comes to the community level. So people think that most of the time it has to do with the government, the leaders, and then policy change and all of that. But then I have seen that even if we have policy change and then we have our government doing a lot about these malaria issues, even if there is enough funding, but then the people or the individuals who are prone or are very close to having malaria are not doing a lot to fight for or help in the elimination of the malaria issues in our countries, then we will still get nowhere. So it is important for these people to also know the benefits or the importance of using these innovative products that has been created for us to use. In terms of dealing with malaria during this COVID period, as a youth leader for health, when we came back from Addis Ababa in somewhere February 2020, we were so poised and then so energetic, and then we had a whole lot of ideas and activities we want to implement. But due to COVID-19, we weren't able to do those things. So we resorted to using virtual platforms. And then I think Alois also mentioned the things that we did with the Beat Continue. So we had this hashtag called the Beat Continues. We had the Happy Moment videos. We also engaged the CHOGM 2020, that's the Commonwealth Health of Ministers meeting. We engaged them on social media World Malaria Day 2020, we had an engagement on social media. So we've always had our advocacy moment on social media and a little bit of in-person activities. So that is about how we did in terms of advocacy during the COVID-19 period. And then I also think that apart from this virtual engagement, we can also engage young people, especially in the grassroots, to plan and implement malaria activities in terms of having fun, because I've noticed that young people usually like to have fun in terms of building up or listening to some of these talks and then learning some of these things. So in order to get them involved and wanting them to participate, we need to also add a little bit of fun. We also have to have structures for bring young people together in support of the initiative in different ways, including financing. That's what I mentioned, where we can bring up increase domestic funding to help in building or in eliminating malaria in Africa. Also, the last point I have here is encourage and train more young people into going into malaria research and then ensuring rights and accurate data for effective decision making. I think also that was mentioned by a previous panelist, and then it was well explained. And I think, yes, if we do some of these things, it will help our chances in eliminating malaria by 2030. Thank you.
Thank you very much, Michael. All the recommendations you share are actually very necessary. And what sticks in mind is fun. No one is really talking about how the youth, they like fun to be integrated into their activities. So I look forward to also that aspect being introduced into how policies are formulated, how programs are implemented, and just ensuring that it's not always a dull moment when it comes to malaria response in Africa. Ladies and gentlemen, we are moving on into the next item of the agenda, and we'll have our last speaker who's going to share with us recommended actions before we get the closing remarks. I would like to invite Ms. Zainabu Tina, who is also a member of the ALMA Youth Advisory Council, and she will shed more light on actions that she has seen working at the continental level. Welcome, Ms. Zainabu.
Thank you, Whitney. So my name is Zainabu. I will introduce myself very quickly. I'm the program officer of Impact Santé Afrique and the platform CS4Me, which is the civil society for malaria elimination platforms. So we are involved in the strategic communication. We are coordinating advocacy campaign to call our leaders in increased domestic resource funding in health. But to be more specific, to increase malaria funding, and we also ensure that malaria programs to be more effective, gender transformative, right-based and equitable and adequately funded, because the communities' needs must be placed at the center of the concerns. One of my best experience was being a part of a group of young people involved in the fight against malaria, TB, and HIV, who wrote and read a statement to world leaders in Lyon at the 6th replenishment of the Global Fund in October 2019, because promise alone are not sufficient. So as the ALMA Young, for the ALMA Youth Advisory Council, we upload President Uhuru's Kenyatta initiative to create this council, because we need to have young African leaders committed in the fight against malaria. So I will talk about the recommendation to take strong action for the IAC structure. This structure is here to allow us to become the voice of the voiceless, to develop a teamwork led and directed by young people who share a common concern, how to end malaria, our eldest enemy, and which continues to kill our mothers, fathers, brothers, and sisters. So in order, I will propose that we will need to intervene at the decision-making table so that decisions are made with us because it's our future. To organize virtual or in-person advocacy activities to move the lines, to organize annual meetings to take stock of our activities, and also to include youth at national, regional, and international committees in order to work closely with the CCMs, the NMCPs of our countries, the ministries, in order to have a real impact at the continental, the national, the regional, and the continental levels. So at the IAC Council also, we will share our work and contribution in order to use the best practices that work in our countries, to participate in international meetings, to share the experience communities who are affected by malaria, and to ensure that this disease remains a priority on the agenda of our head of states, to benefit from capacity building and tools to be more effective in advocacy, such as the ALMA scorecard, which is an excellent advocacy tool, to give us the resources to make IAC a strong network in strategic communication in the fight against malaria, to encourage our leaders to increase not only the domestic resources allocated to health, but also to matching funds for malaria grants from the 2021-2023 Global Fund. Otherwise, it will be the communities that will once again pay the highest price. So we will do that to get young entrepreneurs and employees from diaspora, medias to commit themselves in the fight against malaria. We will encourage young scientists researching on malaria and as well motivate others to also make in the study area so as to boost the workforce and medical students such as medicine, biomedical laboratory science, pharmacy, nursing, among others, to highlight the work of community health workers who save their lives in remote areas where communities don't have access to health centers, and also to support engagement of youth in the civil society global malaria platform. For example, the CS4Me platform and also the RBM Youth Workstream platform, to have discussion on how to reach the universal health coverage in our countries. And I will end with the last but not the least, to engage young political leaders in this conversation so that they can represent our voices in the various houses of parliament. This will help us make progress in the fight policies-wise. So the youth do not want to have decisions made from them anymore. We want to fight for our future. We are the generation that will end malaria, and without your help, leaders, our goal will be difficult to achieve. Thank you, Whitney.
Thank you very much, Ms. Zainabu, and powerful points there, that if we do have young people who represent us at a leadership level, they should be upfront and loud about the needs that are at the community, because now is the time every struggle that the community has been undertaking or taking up on behalf of the continent should end. And she reiterates rightfully that this is the generation that will end malaria. And so we've heard it. Thank you very much, Ms. Zainabu. And her recommended actions bring us to the end of the sessions where the speakers share with us their their experience and respective evidence from different areas. And I would like to give a special thanks to all the panelists and all the speakers. We would not be much into the understanding of what the malaria response is about and what is working if we did not have people like you at the front lines, working with the communities, with the leaders at different organizations and collecting all these experiences and then making time and presenting yourself here to speak with us. So I encourage the participants who are with us, continue sharing your questions and engaging the panelists, and also tell us what are some of the recommended actions that you are seeing working in the countries. Please comment in the chats and let's continue with this conversation. I would like to welcome our next speaker, who is going to talk more on the march to the summit. I hear there's enough exciting activity brewing to the summit that was mentioned by our speaker from Commonwealth, Ms. Tusia. And so I would like to welcome Ms. Maya Ba, the Strategic Communications Manager at Speak Up Africa, who is going to share the closing remarks, but also tell us more about the march to Kigali. Maya, over to you.
Hi, Whitney. Thank you so much. Very happy to be here and talk about this campaign, but very happy also to share this platform with amazing youth advocates. And very, very happy to have all of these recommendations. So what is the March to Kigali? Slide, please. So in the context of, Africa being the continent that is bearing the burden, the biggest burden of neglected tropical diseases and malaria, we at Speak Up Africa have are working with civil society organizations to make sure that we are bringing another seat at the table, which are communities, civil society organization, and youth groups. So the malaria burden in Africa is pretty immense, and a child dies of malaria every 2 minutes. Also, neglected tropical diseases, they affect more than 1.5 billion people around the world, and close to 40% of their burden occurs in Africa. So we had speakers earlier talking about the Commonwealth engagement, and this year in June 2021, the Commonwealth Heads of States Summit will happen in Kigali. It was supposed to be happening last year, but because of COVID-19, it was postponed, and so it will be happening this year in Africa. And what is really important about this summit is that on the margin of the summit there will be the Kigali Summit on NTDs and malaria. And because of the importance of this summit happening in Africa, and especially in Rwanda, which is a very innovative country and who's doing a lot of efforts and has a lot of success in the fight against this disease, we at Speak Up Africa and with organizations that we're working with decided to launch the March to Kigali. Slide, please. So the March to Kigali is a physical, but also a virtual march. We've talked, Whitney, you've talked about it, and people talk about it, about the space that we are in now, which is a more virtual space. So the March to Kigali is really making sure that civil societies and youth groups, like I said, have a seat at the table and have the platforms to talk about malaria and NTDs. And so this campaign builds on existing partnerships and platforms, which are the No to NTDs movement that was launched in 2018, and also the Zero Malaria Starts With Me that everyone knows, that was launched in Senegal in 2014 and then adopted by the heads of states and governments of Africa in 2018. And that is now implemented in more than 19 countries across the continent, thanks to Whitney, thanks to ALMA, and thanks to a lot of people who are here today. Slide, please. So what are the campaign goals of the March to Kigali? Well, it's increase public awareness because, you know, we have talked about it, and malaria is a silent killer. We really need to make sure that malaria is not considered as a fact of life, but make sure that people, communities, citizens across the continent know that malaria is an entirely preventable and treatable disease. And also NTDs, as their name suggested, they are neglected. But the question that comes a lot of time is like, who is neglected? Is it the diseases or is it the people that are affected by them? So we really want to make sure that we increase awareness about these two diseases. Well, the NTDs, which are 20 diseases and malaria, sorry. We also want to make sure that we generate demand for increased funding. We have talked about this. We have across the continent, we have a competition of the allocation of resources, and we need to make sure that malaria and NTDs are at the top of our priorities. We also want to make sure that we encourage a multi-sectoral approach and strengthen the capacity of CSOs and youth groups across the continent. Finally, we want to make sure also that business leaders and private sector companies are engaged in the fight against these diseases, because we need more funding and especially domestic funding in Africa. Slide, please. So actually the march started on April 7th, which is World Health Day in Sierra Leone. And right now we are moving to Guinea with a lot of activations. We are also having some activations that are physical, like I said, and also having some virtual activations like quick chats and op-eds and webinars. So the goal is really to make sure that we highlight the efforts and the challenges and the successes that the countries that the March to Kigali will be passing through are highlighted. So the goal is really to make sure that everyone understands their role in the March to Kigali and understands that this summit, which even though it's a Commonwealth, so it's an Anglophone summit, Francophone countries also have a seat at the table, and they are able to, you know, share their successes, but also make sure that these diseases are prioritized. Slide, please. And so everyone is invited, even though you're not part of a country that is part of the March to Kigali, you are invited to participate. We have a call to action on Speak Up Africa's website. Please sign it and make sure that if you want to participate in the campaign, reach out to me. And big thanks to my colleagues and everyone at Speak Up Africa who have been implementing this campaign, and we're still marching. Thank you so much.
Thank you very much, Mael. And I don't know about you, ladies and gentlemen, but I am ready to march to Kigali. And I hope that you will join me, you will join Mael, you will join Speak Up Africa and the rest of the communities and the countries that are involved, because after all, zero malaria starts with me and with you and with all of us. Thank you for making time again to join us for this very important conversation. I invite you to reflect on all that the speakers have shared with us today, the opportunities you've heard, the ALMA Youth Armies, RBM, Digital Youth Work Stream. And if you go to the social media pages of the African Leaders Malaria Alliance, you will see the hashtag, the handles for all the speakers who've spoken today, the respective hashtags that are being used for the continental malaria response. And it will be easy for you to track the ongoing initiatives and see how you can come on board and be with us. We have come to the end of this webinar, and I wish you good health, and I look forward to seeing more of you in the malaria response and in the respective campaigns. Please check the chats. I can see the links to the campaigns and the March to Kigali initiative there, and be sure to come on board. Take care, everyone.